Let's talk about Clostridium difficile infection, CDI. Clostridium difficile infection. We call it C. diff or call it CDI. Uh, Clostridium difficile is an organism that can infect our intestine, produce spores that are toxin, and they can damage our intestinal tract. Interestingly, my intestine and your intestine have bacteria inside. Our intestine have a lot of normal bacteria inside. They form a little ecosystem. And this bacteria in my intestine can protect me from getting a CDI. So even if spores of a Clostridium difficile enter my mouth, into my intestine, the bacteria that have already been there can normally suppress this C. diff infection. However, under certain circumstances, this C. diff infection the spores can germinate in my intestine and cause problem. What are the risk factors? Number one, advanced age. The older we are, the higher the chance of getting C. diff infection. Number two, acid suppressant. Our gastric acid actually do help kill certain bacteria and spores. So when the gastric acid is suppressed, like taking a gastric medicine for other reasons like reflux or peptic ulcer, our resistance actually drop. Number three, most important, most common cause is because we're taking concomitant antibiotics. It is believed that if I take an antibiotics, say for a skin infection, for joint infection, for urinary tract infection, the bacteria can kill the infection, yet it can also kill the good and the bad bacteria in my intestine. So it disrupts the ecosystem in my intestine, bacteria, flora, we call it microbiota, and they can, as a result, they are not able to suppress the C. diff infection from growing. In other words, our normal intestine bacteria help to suppress a C. diff infection from becoming serious. Yet, if my normal intestinal bacteria are disrupted, usually by taking antibiotic or sometimes by an operation, then the bacteria is disrupted, so they fail to suppress the C. diff infection that we take in by mouth, and they can hence cause C. diff infection. Patient can be very ill. They can have vomiting, diarrhea, fever, tummy pain. They can be very dehydrated. They can go to a heart problem, a kidney problem, and the dehydration is not corrected. How do we treat? The first way of treatment is recognize the infection. We have specified stool tests that we can use to confirm if we can find the toxin or the bacteria in the stools. When we find a toxin in a patient with diarrhea, there are recent injection of antibiotic, we take it very seriously as a C. diff infection. First line of treatment is to replace the salt and water by a drip or by increasing oral intake. Second one is to try to stop, if possible, the offending organism, the offending antibiotics. Hopefully, the bacterial flora in the intestine can be reestablished. So if someone that do not need a particular antibiotic, stop it. If the diarrhea is serious, then we get them admitted for hydration and we give them a therapeutic treatment. Currently, the two first line treatment that we use, first is oral flagyl or metronidazole. It is cheap, but it is not recommended the first line because sometimes they relapse after we stop the flagyl. So the second line is called oral vancomycin. We used to have to dilute the vancomycin into solution after the drink, okay, because they don't come in the tablet form. But vancomycin now come in an oral tablet form. They make it much easier. We can give it to the patient, let them take it. They take the antibiotic oral vancomycin or flagyl for about 5 to 10 days and until the diarrhea stops, and then that's it. Recovery, most of the time they recover. Very few percentage of my patients have recurrent C. diff infection. That means when we give them oral vancomycin, they recover. We stop, they come back. If they keep having repeated, recurrent, multiple times of C. diff infection, then the definite treatment is to change the bacterial flora altogether, which is called fecal transplant or fecal microbiota transplant, FMT. So far, there have been some places in Singapore doing it. I understand that Mangi Orchard as well as NUH, they have been doing that. There may be other centers doing that. So when I have a suitable patient, I send to NUH for them to do the fecal transplant. But for patients that have C. diff infection before, the C. diff may recur in future. So I always told my patient, this is a C. diff infection, it may come back in future. So from now on, try to be very careful before you are given antibiotic. Don't anyhow take antibiotics. Only take the antibiotic when you absolutely need it, such as a proven serious infection. Besides that, look out for diarrhea or vomiting or tummy pain symptom during antibiotic. If in doubt, tell your doctor, I have history of a C. diff infection till 2 years ago when I take antibiotic for my urinary tract infection. Now I just took antibiotic for my skin infection and I'm having diarrhea. Maybe I have a recurrent C. diff infection. Let your doctor know and the doctor will do the necessary test, stool test to confirm the infection. So to sum up, C. diff infection is not common, but it can occur usually in people that's after taking antibiotics. We need to hydrate, replace the salt and water. We need to stop we need to stop antibiotic unless they are absolutely necessary, and we may have to give them specific antibiotic, oral vancomycin or oral flagyl, to treat them. Most of the time they are fine, but if they take the same antibiotic again in future, they may recur. And for patients, very rarely they have recurrent, repeated C. diff infection. We consider fecal transplant as a final treatment that can have been well shown in many studies to help them. So I hope you learned something from me about Clostridium difficile infection or C. diff infection. Thank you.